All right, I think we have nearly our full group, if not our full group. So I'll go ahead and get us started. Hello and welcome everyone. I'm Brittany Cooper from Washington State University, and along with my teammates and colleagues, Gitanjali and Clara, will be helping to facilitate today's discussion. I'm going to share my screen here, just so you can see. Let's see, how's that look? Got the agenda up on your screen, hopefully. Great. Awesome. So this gives you a sense for what we'll be doing this afternoon. I'll start with some general goals for our discussion today and some introductions. And then I'll be describing a little bit about the keys to effective data storytelling. And then Gitanjali will share with you some more details on the CPWI community-specific handouts, which you should have received from Tyler yesterday. Hopefully you got that email. And she'll be sharing some example handouts and talking through kind of the strategy we use to compile those. And then we're going to leave quite a bit of time at the end, about 30 minutes or so, to start brainstorming about how you might go about using those handouts. You'll get a chance to jump into a breakout room with some of your colleagues and share ideas and brainstorm how to make the best use of these. And then we'll also have some time for just general questions and discussion at the end. Okay, so a little bit about us. We come from the WSU Impact Lab, and we've been collaborating with DBHR for a number of years, in particular on the CPWI evaluation, which is the role that we're kind of playing in today's session as the primary evaluators of the statewide initiative. But in general, we're really interested in how we can best use prevention research to inform practice, and how we can kind of get that information out to the widest audience possible. So today's session is a really good example of that. We love doing this kind of work because we get a chance to talk to you all about research and data, and you all get to teach us about how that information can be used to promote and continue the great work that you all are doing in substance use, misuse prevention on the ground. So we're excited to talk more about that today. We have a couple of key goals for today. We'd like to hopefully have you coming away from today's session feeling at least a little bit more empowered to effectively tell your community's prevention story. We'll familiarize you with the specific handout that I just mentioned, and also begin helping you interpret some of your substance use prevention data, although I imagine you've been doing a lot of that work already in all of the work that you're doing in the CPWI process. And we'll also, like I said, provide you with a couple of examples for how you might personalize the handouts to suit your local needs, and it's kind of just some key principles and approaches that you might want to use when doing that. So as I mentioned, I wanted to share a little bit with you about what we see as the keys to effective data storytelling and provide you with some just basic background information on that. So why is it important to combine both data in combination with a story? And the reason is we know from a variety of social and neuroscience research that information is processed differently when data is combined with a story. So there's Brent Dykes is a person who does a lot of work in this area. He's written a book on this topic. And so I point you to some resources along the way that he has shared. But he summarizes this information well, I think, when he says that people hear statistics, but they feel stories. And I think we all kind of know that intuitively and probably have had our own personal experiences with that. But there's research actually to back that up as well. They find that stories are more memorable than statistics alone, probably not surprisingly. When we combine data along with a narrative story, the information also becomes more persuasive and more engaging. We tend to be less skeptical and critical when someone's telling a story, as opposed to just sharing kind of statistics with us. So it's really important that we couch all of the evaluation data within this broader narrative and local story of what's going on in your communities. Another way to think about that is that the brain works differently when trying to interpret statistics as opposed to listening to a story. And so another great quote from Brent Dykes is that creating a data story helps build a bridge to the influential emotional side of the brain. So if you're trying to convey data, to convey evaluation results with the goal of either changing someone's perception or engaging them to do something with that information or act as a result of that information, it's even more important that you combine data with a story. So this slide really reinforces this idea I've just been mentioning. People tend to put up their shields when they're hearing just dry factual arguments, especially when they're in contrast to some of their own existing beliefs. But they tend to drop this guard when listening to a story. So again, another just justification or reason why we want to combine data with storytelling. And that's really what we're hoping you'll be able to do, at least to start doing with the community-based handouts that we've been developing. So there are three key components to creating a good data story. There's the data and the statistics, along with visuals to represent that data, and then the narrative. So as the CPWI evaluators, we can certainly provide you with the data and with some of the visuals that represent that data, but we really need you to help contextualize that information with the narrative about what is actually happening in your community. So when you're crafting your narrative, there are a couple of key questions to ask yourself. First is, why do you want to present the data? So we include a couple of examples here on the screen. You might want to raise awareness about a problem in your community. You might want to inform stakeholders about the activities you've been conducting to address that problem. You might want to simply keep your stakeholders informed and also hopefully get their support and engagement in the efforts that you're making. But there are probably a lot of other reasons that you might want to share data as well. So I'll just stop here and ask folks if you have other ideas about why you might want to present data related to the CPWI initiative that aren't listed here. Feel free to share those. Either come off mute and share them, or you could type them in the chat box as well. Any other ideas for how or why you might want to use data?
One requesting grants is in chat.
Oh, great. I couldn't see the chat box. Thanks, Clara. Great. Yeah, so certainly when it's trying to secure additional resources or funding for your program or for your initiative. Other thoughts?
Recruitment.
Coalition member recruitment. Yeah. So showing them that, you know, you've got a strategic approach to how you're approaching your problem and are doing all these wonderful things in the community and, you know, trying to convince people they want to be a part of all that awesome work. Yeah.
I think one of the biggest resistances to people joining coalitions is like, well, what are you going to do about it? There's nothing we can do, right? So.
Right. Definitely. All right. Is there anything else in the chat box? For some reason, Zoom will not let me look at the chat box. Okay. I'll let.
I missed the first one, which was just ensuring you're going in the right direction.
Great.
I think everything else has been covered.
Yeah, so I mean, sometimes you're communicating data or wanting to look at data to communicate to external audiences, but just as important to communicate to your own members and kind of track what you're doing and why you're doing it. Yeah, thank you. All right, so another question to keep in mind when you're thinking about your data story is who's your audience? And this goes hand in hand with kind of why you might be presenting the information, is also who are you presenting the information to? And really what's important to them, kind of what's their perspective, what's their role in the work that you're doing. And so we have a list of questions listed up here for you to consider for each individual audience you might be trying to target. This might help you craft and decide, you know, how much information to share, what type of information to share, that sort of thing. So important to keep in mind the goal you're trying to achieve and the audience you're trying to kind of present to. Are there other kind of audiences that you're communicating information to that aren't listed here? So we have kind of what we think are the key ones, including youth. You might be trying to engage youth in your coalition work, parents or other families in your communities, educators, legislatures, any other kind of local decision makers, other members of your coalition that fulfill these various roles. And then of course, funders. Is anyone key that are missing from this list? Or did we capture them? We got most of the main ones. Okay. Again, if you're writing in the chat box, I do apologize. For some reason I can't see that.
Beverly, yes, we can send the slides and provide access to the recording. And Brittany, Benjamin had said Board of Health, and then the community was also mentioned.
Great, thank you. So in addition to kind of why are you presenting the data and who you're presenting the data to, there's also been work done in how you frame your message effectively, kind of what techniques tend to be most effective. Specifically, the Frameworks Institute has done work in this area, and I provide some links on these slides if you want the details. But in their work, in their research, what they have found that is specifically with the topic of adolescent development and substance use in particular in adolescence, the combination of appealing to moral responsibility with the explanation of the effects that substance use can have on adolescent development in their work has been found to be the most effective. So this is going to share just one example of how you might do that, kind of that combination of both appealing to moral responsibility as well as trying to make clear what the potential effects of substance use is on the adolescent developing brain is what they found, like I said, to be most effective. Another thing that they've found in their work is that metaphors can be really helpful, especially when you're trying to correct misperceptions and promote public support for an approach like CPWI. And so this example here shows you one way of doing that. One metaphor that they've found to be particularly effective in this area is this idea of boiling over, that many adolescents will experiment with alcohol and other drugs, and what we're trying to do is to prevent turn down the heat so that it doesn't end up boiling over into some bigger, larger, long-term problem. Because what they found in a lot of their work is that in general, the public kind of perceives adolescent drinking and substance use as, oh, that's just experimentation. It's no big deal. They'll get over it. Whereas as we all know as prevention professionals, that that's not always the case, and that it's a really important area that we need to focus our energy on in providing kind of supportive environments for adolescents and reducing the risks associated with substance use. So that's one approach to how you might frame that message more effectively. This provides just kind of a summary of what we think the keys are to effectively telling your data story. So we mentioned this already, know your goal and audience. Also, don't overwhelm these folks with too much information. Don't get caught in the details. That can be hard for us as researchers, and I'm not sure if it's the same for you all, but we start going down this path of wanting to describe every caveat associated with every finding we have. And but you don't want to do that often when you're trying to communicate to these types of audiences. Using these effective messaging framing techniques along with the data and the visualization and the story, all of those things in combination is when you're going to be most effective, and really developing kind of a plan, a strategic plan for how you're trying to communicate why and kind of what your dissemination efforts will look like. So any general questions or comments on what I've presented so far before I hand it over to Gitanjali? She's going to describe to you and walk you through the community specific handouts and kind of why we crafted them in the way that we did, and also share some examples, but just wanted to stop and see if others have thoughts or questions at this point. Oh, I can see the chat box now. It suddenly appeared on my screen, yay. Okay, so I'm not seeing any questions. Anyone want to come off mute and anything to contribute at this point? No? Feeling good? Okay, great. So I will hand it over to Gitanjali then to talk a little bit more about the handouts.
Thank you, Brittany. And now, as Brittany mentioned, I will briefly talk about the community-specific handouts that you have received. And these handouts are based on the results of the community level evaluation that we have done as part of our CPWI evaluation initiative. So on the screen, you can see the handout. It is a two-sided document. The front page is the same for all communities in a cohort. We describe cohort as all communities that started CPWI implementation together. So the back page of the document or the handout is where you can personalize the handout to suit the specific needs of your community. And I will go over all the different sections of the handouts and also show some examples of how the handout can be personalized to fit your local needs. Next slide, please, Brittany. Thank you. So here we start with a broader impact statement of what it is that CPWI aims to achieve. Local coalition approach can improve youth wellness. So research has shown that for a broader impact, it is more effective to start with what you want to achieve rather than the problem statement. So here, rather than stating that adolescent substance use is a problem in Washington state, we have reframed the message positively and emphasized that we want to achieve youth wellness as an outcome. And this can be done through the help of local coalitions actively working towards prevention. Next slide, please, Brittany. Thank you. So while we are describing how local coalition approach can improve youth wellness, it is important to give context for why adolescents are especially sensitive to the harmful effects of substance use. So if we just write about youth substance use statistics, then it might be difficult for the audience to interpret those numbers. Some might think these numbers don't look that bad, so why do we need prevention? Others might think these percentages, are they good? Are they bad? How do we interpret that? So it would be good if we can help the readers interpret these numbers and provide context so that we can argue for why prevention is needed and why prevention is important. And this is what we have done in our handout. Next slide, please, Brittany. Thank you. In this section, in the previous section, we had briefly talked about what CPWI is, and we also have given a website where readers can find more information about CPWI. And then in this section, we demonstrate the results for CPWI communities. So in this section, we highlight the results for CPWI cohorts as a group. And for our evaluation, we examined pre-CPWI prevalence rate to post-CPWI prevalence rate to see if there has been a change in substance use and risk factors from before CPWI implementation to after CPWI implementation. And if there has been a change, we also examine usually whether or not the change is statistically significant. So if you notice in your handout, there is a small note at the bottom saying that these results are for CPWI cohort 1 or CPWI group 1, and that is because for group 6, we don't have post-implementation data for healthy youth survey yet. So it is not possible for us to do a pre-test, post-test evaluation, but we included these results here to show that CPWI does work. And with implementation, CPWI will have an effect on cohort 6 communities as well. So this is a good way of showing to the stakeholders CPWI has an effect on other communities, and we are also hoping that it will have, with time, effect on our communities as well. Next slide, please, Brittany. Thank you. So this is the first section of the back page, and this is where you can really personalize your handout. You can talk about various things here. You can give a description of your community, of your coalition. You can talk about coalition needs, community needs. You can share success stories. You can talk about member testimonials. You can provide photos. So whatever you think would most appeal to your audience. And again, it is important to think about what Brittany had talked about, what it is that you are trying to convey, and who is your target audience. And those questions will help you decide what to put in this section. And I will also go over some examples of handouts that we have created that we'll also be sharing with you. Next slide, please, Brittany. Thank you. So this is the results section. And for here, normally we would put a pre-test, post-test, and how communities have done before CPWI versus after CPWI. But for your communities, we have compared the 2018 Healthy Youth Survey 10th grade substance use prevalence rate with the statewide rates. And these outcomes were selected based on the logic model for cohort 6 communities. And if you notice on the right, we also have a text box where we have given some general information about comparison, like whether community rates are higher than, lower than, or similar to statewide rates. And for our purposes, we have used 5% as a cutoff point. So if the difference is 5% or more, we say that the community rate is either higher than or lower than statewide rates. If the difference is less than 5%, we just say that it is similar to statewide rates. So next slide, please, Brittany. So for many of you, you might have noticed that your graphs look like this because we had to suppress the results for substance use outcome because the sample size was low. So if fewer than 20 students or respondents reported using a substance, we suppress the results to protect the confidentiality of the respondents. And it might be difficult to present these results, especially when all the results are suppressed, but we can brainstorm about how you can present results for your specific communities later during our discussion. But we have also given a specific sample of how you could potentially use these results to personalize your handouts. Next slide, please, Brittany. Thank you. So for those of you who have adequate sample size, you might be wondering, okay, what if I want to test for significant differences for my communities? So here is a resource for you. Brittany, could you please press next? Thank you. This is the Healthy Youth Survey tool for determining statistical significance, and you can get this tool at www.askhys.net/training. And it is a downloadable Excel file, and the instructions are very clear on how you can go about testing for differences. The only thing to keep in mind is that in order for you to test for these differences, the sample size has to be at least 30 or more students for the local results and 30 or more students for the state results. And if you do meet those numbers, then you can definitely use this tool to test for significant differences between your results and state results. Next slide, please, Brittany. Thank you. So here we have a sample handout for you, and Clara will also be sharing these handouts in the chat box, and we'll also be emailing them out later. So when we are trying to come up with some content for this hypothetical coalition, we were brainstorming these questions that Brittany had talked about. Why do we want to present the data, and who is our audience? So we wanted to inform our stakeholders about the efforts that is being made to engage youth in the community, share success stories, and engage stakeholders in prevention audience. And we thought that the audience would be general community members, parents, youth. So that's how we came up with the content. So if you notice in our sample handout, our title is How We Are Engaging Youth in Substance Use Prevention. We give a very brief description up top of what the coalition is. And then we mostly talk about how we are organizing various events in high school and how youth are finding that these events are very helpful for them, and many youth, they choose to be engaged in these activities even after they have graduated high school. And at the bottom, we have talked more about the Anytown Coalition and how if people want to get engaged, they can contact Anytown Coalition coordinator, or they can visit the website. So this is one way of personalizing the handout. Next slide, please, Brittany. So this is the, excuse me, this is the second handout. And if you notice here, we don't have any graphs. We just talk briefly about how there are some outcomes that are doing better in the community. For example, rates of adults in drinking and e-cigarette use are lower in the Anytown community, but there is still work that needs to be done because rates of marijuana and painkiller use are higher than statewide rates. And we have in a way, use this opportunity to advertise or advocate for the Strengthening Families program by saying that one way that adults can talk to their kids about substance use is through effective communication. And that's what Strengthening Family program teaches you. And on the top, we have given more information about Strengthening Families program. And we've also given a testimonial about how Strengthening Families program has been very helpful for one particular participant and their kid. And at the bottom, we have a flyer of sorts for advertising the upcoming Strengthening Families program, and specifically emphasizing that dinner and childcare is provided. There'll be weekly gifts, prizes, just making sure that the reader has all the information they need to contact the coordinator to ask more about the program. So this is one way, but there are many other ways, and I think we will discuss that more in our discussion. So.
Thanks, Gitanjali. So I'll stop here and just check in to see if folks have specific questions for Gitanjali based on the information that was just presented. Feel free to come off mute or type in the chat box. Because what we'll do next is give you an opportunity to start reviewing your own handout if you haven't already. Maybe take a closer look at the sample handouts, and we'll give you some time to talk in breakout rooms with colleagues about how you might use the information provided in your handout, how you might approach kind of, the questions about what data, why to present this data and who your audience might be, and hopefully have some good exchange of ideas there. So any questions for Gitanjali before we do that? Okay. All right, well, what we're going to do next then is to give you a chance to do what I just said. So to individually and as a group kind of brainstorm how you might start using these handouts. We're going to break you out into rooms where you'll be in a room with your fellow community. If you have multiple representatives from your community, you'll be hopefully in the same room with those folks plus at least one other community. And we're hoping that'll give you an opportunity to kind of exchange ideas with each other. So I think Clara has those breakout rooms ready to go. And like I said, the main questions that you'll be kind of discussing are, why you might present this data and who your audience might be, and just kind of strategizing about what you might do to tailor and personalize the handout for your community. We're going to give you about 15 minutes in those small groups to have that discussion, and then we'll come back as a large group and answer any questions and have just further discussion and sharing as a large group.
And if you find yourself in a breakout room with only someone from your own community, just let me know. Come back to the main room. All right.
So you should see popping up on your screen an option to join your breakout room. And if you don't, let us know and we'll figure it out.